Sinus infections and ear infections do not need gut-wrenching antibiotics. Today, I'm going to share with you 5 natural antibiotics that we can use to take care of these acute infections.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Utah. On this channel, I share with you how we can help heal your body and treat symptoms without those harmful drugs or surgery. Be sure to subscribe to start your health journey. I recently filmed a podcast with my co-host Teresa where we talked about 5 natural treatments that we could do to treat acute and chronic ear and sinus infections. Make sure to stick around till the end because I'm going to talk about the big culprits of why you might keep on getting chronic ear infections and chronic sinus infections. So number one, silver is a fantastic antimicrobial. When I say antimicrobial, it's good on killing off all bugs. So it's going to be able to kill off the bacteria, the viruses, the funguses, whatever is hanging out in the ears and the sinus passageways. And many of the treatments that I like to prescribe are like that because we don't always specifically know, is it a virus? Is it a bacteria? Is it a fungus? And many times you might diagnose a bacterial infection hanging out in there, but there's probably a fungus infection hanging out in there too. So it's great to use a broad spectrum antimicrobial antibiotic when we are treating these infections. My favorite thing to do with silver is I like a nanoparticle silver. There's so many different types of silver out there on the market. I am very picky. So you can make your own silver out there. I know a lot of people are doing that. The only problem with this is it's not as absorbed and it doesn't eliminate from the body as well. So it makes these little sheds of silver in there. And if you look under a microscope, when you look under there, you're going to see these little specks of silver all over the place. When you use a nanoparticle silver, you're going to see these little dots all over. So it's in this silver hydrosol, and it's actually going to be able to be absorbed very readily and also eliminated from your body. So some people, when they think about silver, they're like, oh crap, I'm going to get a graia, which is that you're going to get gray, because they read all these horror stories. If I take silver all the time, I am going to get gray. So when you take a nanoparticle silver, that's just not going to happen. If you take a non-nanoparticle, or if you start making your own silver and you're taking it every day and you're doing high doses, yeah, has a potential. So there isn't that concern if you are using silver in that regard. So always use a nanoparticle silver. So how do I use it? So let's say if I'm using it for a sinus infection, I like to take it orally. That means that you take it by mouth. You take about 1 teaspoon and you do it about 3 or 5 times daily, depending on what we're treating. If we're treating a chronic issue or acute issue, if you're treating an acute issue, sometimes I go up to 5 to 7 times a day. If I'm treating a chronic sinus infection, usually I'm only doing it 3 times a day. But at the beginning, I'm using about 5 to 7, like for a week or two, and then I'm doing about 3 times a day because we're going to be doing this for about a couple months when it's treating a chronic sinus infection. So I also like to do it intranasally. It's a really fantastic way there. So you get a spray to spray up into your sinuses, 5 to 10 sprays per nostril. You do that 3 times a day. That is with chronic and with acute situations. So that's how I use silver to treat my patients. Now, let's say if you have an ear infection, you can do the oral way. That's great. I like you to gargle it, because you gargle it, you have these little tubes in the back of your throat that actually your ear canals attached there. So you can get some of the substance hanging out in there. And also a lot of the bugs from the ear infection are hanging out in your throat. So you gargle it and then you swallow it. I also like, you can put it straight in the ear canal. And that is a great way to take care of the ear infection also.
As far as when you administer it orally, it seems like if you administer it orally, it would go through the digestive tract before entering your body.
Yep.
How does it help by going through the digestive tract? How does that affect everything else, as far as sinuses and ears work?
So when you take it orally, it's going to go in your entire body. It's going to get systemic throughout your body, and it is going to go into your sinuses through there. You always do want to take silver away from food because it won't absorb as well. So you want to take it at least 30 minutes before a meal, something like that, to be able to get it effectively in there. But when we're treating sinus infections, I like to not just do local, but also systemic treatment, because you're not going to clear it all with just doing local treatment.
Is there any benefit to holding it under your tongue for 30
Yes.
seconds?
Definitely, for sure. That's a fantastic way to try to bypass the gut and help with the absorbability. So if you're trying to do like a systemic treatment with silver, thanks for bringing that up. It's great to hold it underneath your tongue for 30 seconds and then swallow it.
Now, for our audience who's listening, I know from what I've learned is that underneath the tongue, there's a lot of veins that are right there on the surface. And so if you're using a substance that's able to permeate the veins that are there, it
Mhm.
can enter right into the bloodstream. Am I right, Dr. Jake?
Yep, you have these big, awesome veins hanging out right in there, and you're able to get that substance right into them. And then that goes systemically throughout your body and bypasses the gut. So it's going to be going in your body much more quickly.
Awesome. All right. So the second one that you have on our list is garlic. Tell us about garlic.
So garlic, one of my favorite foods, and also it's a great antimicrobial. The unfortunate thing though with garlic is when you cook it, you take away a lot of its antimicrobial
Mhm.
capabilities. Now you get a lot of the cardiovascular benefits still, great, but when you cook it, you're going to lose a lot of the allicin, which is the antimicrobial substance that we want to kill off the bacterial infection or maybe the virus or fungus. Again, garlic is a great antimicrobial too. It's an awesome antibiotic, but also it's good for killing off other bugs. So how do I use it? For a sinus infection, I do not want you snorting garlic. That's going to burn like crazy and you're going to hate me. So don't do that, please. Don't put it in like a nebulizer either. You're going to hate life. If you do that, you're going to be burning and coughing like crazy. Also, you don't want to put it like in a neti pot because that's going to burn and go like crazy. I say this because I've had patients do this type of stuff. I didn't tell them to. My patients have done that, and it could be very painful, and you won't like life. So
Stay
don't
away
do that.
from Google doctors, right? Those Google blogs that are telling you to do these
Yeah,
crazy
exactly.
things.
Yeah. So what we want to do is you want to take it orally. So again, we're talking about how you get it systemic. That is a fantastic way to take care of the ear infection, also to take care of the sinus infection. Now, if we're treating a ear infection, my favorite way is you could do it orally. Great, awesome. I like that. But I like to do it in an oil base. So it's a garlic oil. And then I like to also get a garlic oil with mullein in there. Mullein has this anti-inflammatory aspect and anti-pain aspect. So you're in a lot of pain usually when you have an ear infection. So adding that can really help. And you drop that right into the ear canal. You maybe do half of a dropper full of that right into the ear canal. You warm it up beforehand. Like say you put it in slightly warm water. You put the bottle in there for about 5 minutes. That warms it up. And then you put it right into the ear canal. You want to tilt your head to the side, kind of lay on a pillow. Your opposite ear is on the pillow. The ear with the oil in it is outside, not on the pillow. And you sit there for about 15 minutes. And then you put a rag and let some of the oil drain out, and you do the other side. And you do this about 3 times per day. And this is really great for those acute infections that come up, or even if you have chronic infections that keep on coming up and up and up. Again, we're going to talk about some reasons for that, but this is a really fantastic way to take care of these ear infections. Don't take them to the doctor to just get an antibiotic for an ear infection. It is highly effective to use garlic mullein drops to take care of an ear infection. And then you're going to be given a antibiotic, which isn't absolutely needed, and destroy the kid's gut. And then that can lead to all kinds of problems in the future. So please start with the garlic. If it doesn't get clear, yes, go to a doctor and they could check it out and see what's going on. And maybe you're going to have to get on an antibiotic. But I have 5 kids and I have never given my kid an antibiotic for an ear infection. And really, I've never had the need to absolutely give my kid an antibiotic, fortunately. So it's not something you always have to do. Sometimes us as parents, we get scared and we run really quick to get it taken care of because our baby's really in a lot of pain. But if you start doing this garlic mullein drops, it's going to be awesome.
That's so powerful right there. I know my son had a lot of chronic ear infections when he was a baby. And a lot of the underlying causes I know you're going to be talking about later on, but I mean, I was a new mom and I was just rushing off all the time. And I can't even tell you how many rounds of antibiotics that he was on. But because it was a chronic condition, I mean, we would just come right back, another round of antibiotics, another round of antibiotics. So it might have addressed it at first, but it wasn't stopping it from coming back. And so to be able to know that there's other things out there that can help and that don't wreck his gut, very powerful. So I'm hoping that this is really beneficial to so many parents who are listening as well. Okay, the third one you have on our list is hydrogen peroxide. Talk to us about
Number
that, Dr. Jake.
Number 3 is hydrogen peroxide. So when some of you might be thinking here, hydrogen peroxide, I've used that before. That burns like crazy. Why are you using hydrogen peroxide? That's very toxic. It's going to harm people. So what we do is we use hydrogen peroxide highly dilute. For example, we do a 3% hydrogen peroxide solution, and we do dilute that in 30 milliliters of a normal saline, like a saltwater solution. And then that's highly dilute. And some people, when they put it in the sinus passageways, they need to even go, even more dilute, double that to 60 milliliters to work up and go slowly. But you don't really want to do it more potent than 30. Sometimes people are going to be able to do 15. But if you put it in and you do the full dose hydrogen peroxide, you're going to hate me and you're going to start sending me hate mail because it's going to hurt like crazy and it's just going to irritate the sinuses and make it worse. So you want to make sure you dilute it. But this can be a really great thing that you add to your neti pot routine. Add a diluted hydrogen peroxide in there. You can maybe put like, let's say about 3 tablespoons in there. And that can be a fantastic way to go into the sinus passageway. And again, this is a broad spectrum, great for bacterial infections, viruses, fungus, whatever. Because many times when I see people, especially with chronic infections, they never just have a bacteria. They many times have a fungus and virus and other things hanging out in there. So it's great to get that broad spectrum antimicrobial like hydrogen peroxide. So that's with sinus infection. I don't do this a lot, but I know some people do that. You could put it right in the ears, but usually I don't. You could just take it orally too in this way. Take just like a tablespoon of it. Don't do a lot of this. And you work up really slow. You just do a little, don't start with the tablespoon. You start with 1 drop, then 2 drops, then 3 drops, and you work up maybe to about 20 drops or so, which it sometimes doesn't equal 1 tablespoon. So it just depends on the person. If you get nauseous at all, back off the dose a lot. And this can be a really strong substance. You could also, when it's dealing with sinus infections, and I like doing this too, because a lot of people with sinus infections are also dealing with lung stuff, is you can nebulize hydrogen peroxide and dilute it in the same way. You want to do 3% and 30 milliliters of normal saline. You nebulize about 3 to 5 milliliters of that, and you do that once a day, and that can be really fantastic for the sinus infection also. Many times that can be more gentle and not as hard on the sinuses, so that's really my favorite way to do hydrogen peroxide is more get a nebulizer and nebulize it and do it in that way.
Now, when you mentioned about swallowing it, do you need to have a food grade hydrogen peroxide to be able to do
Yes,
that?
yeah, you want to make sure it is a food grade, a USP food grade. Yep.
Do you need the food grade for the neti pot as well, or is that one can you use just traditional
I
3%
usually like people
diluted?
just to get the food grade, get the high quality one, make sure you're getting good stuff.
Keep it
It's
safe.
cheap anyways, so make
Yeah,
sure you just get the good one.
makes sense. Okay, fourth on our list is eucalyptus. Tell us about that.
Yeah, so eucalyptus is awesome. I like to also like to combine that with thyme a lot. It's a combination I like to do for sinus infections. And how I use that is you don't use put you could take it orally and you could do it as a herb or a tea. Really my favorite way to deal with these chronic sinus infections is to do a steam inhalation. So what you do is you boil like a cup of water. You put 2 to 3 drops of eucalyptus and you can put 2 or 3 drops of thyme into that boiling water, and you put a towel over your head, and about 12 inches above the boiling pot you put your head or whatever's comfortable for you, and then you breathe in. Make sure you breathe in through your nose, you breathe in through your mouth, and you breathe it for about 5 minutes. And you do
Mm.
that 2 or 3 times a day when you have acute infection, and you do it once daily if you have a chronic infection. And this can get that eucalyptus killing substances right into the mucous membranes of your sinus passageways, and this can help eliminate the bug. When you're inhaling like this, you're also getting these particles right in the back of your throat, which will help with that. Again, ear infections many times can have infection hanging out in the throat, so that helps do it really well that way. And to treat the ear infection, you're going to be doing the same inhalation, and that's going to help through the throat. It's not going to be specific for the ear infection. It's going to be most effective for the sinus infection. You could use a lot of the other things that we talked about for the ear infection.
Awesome. I can't wait to try it. Okay, the last one that is on your list is one that I am very curious about. I've never used it before. Ozone.
So, yes, ozone. I love ozone, and it's probably my favorite treatment to treat sinus infections and also ear infections because ozone kills all bugs. I love that because of it. And also, what's awesome about it is a gas. So, it is able to infiltrate into those passageways really readily and effectively, and it's going to go right in there. A liquid is more heavy and it's not going to get in there as readily. But when we use a gas, it's able to get right in there, kill off those bugs, and then you're just able to eliminate it really quick. So let me talk about this. Ozone is not something we want to get into your lungs. We've talked about all these things that we want to get into your lungs. Ozone is very toxic to our lungs, so we want to make sure you don't do that. So every time we use ozone and we're doing it like in the sinuses, for example, we're always having someone hold their breath. And when we're done infusing the ozone, we have them blow it out. So it's about 10-second treatment of someone holding their breath. And we do each side of the nostril using ozone. and it's so great. Like if you have a sinus infection or acute sinus infection that's giving you problems for a long time, or let's say you just want to clear it really quick. I mean, you could come in, you have like a acute sinus infection, you do it like one or twice and it's all gone really quick. So it's a really awesome treatment. We also do it through the ears for like if you have an ear infection. So I have this like stethoscope looking little machine. We attach that to the ozone generator and we attach that to the ears and we humidify it through water because ozone is very drying, so it can be a little painful. So maybe some of you out there have done this before and you're like, oh, it's really painful. If you do it right and you humidify it, it's not painful at all. It doesn't cause any pain and people love it. So you put this in the ears and you ozonate it and you do 3 minutes of that. And this is going to get right in the ears, go right through the tympanic membrane and take care of that infection hanging out in your ear canal. And this is really awesome way to take care of it. A really gentle way, no side effects to it whatsoever, and will eliminate the bug. So again, ozone's going to kill off the bacteria, the virus, the fungus, whatever's hanging out in there. So it's a really awesome antimicrobial to take care of these infections. And then it's awesome. I use it most of the time for chronic sinus infections because it is so good at doing this. We do this for a while when we're doing this. We do about 10 or 15 treatments when we're treating chronic sinusitis. It's not usually my only treatment. We're going to talk about some of these other things that we do when someone has chronic issues. But this is a really fantastic way to eliminate these chronic sinus infections.
How do you figure out what is going on? If somebody is listening here that has chronic ear infections, chronic sinus infections, maybe their kids do, what should they be possibly looking at?
The biggest thing that we need to look at when we're dealing with these chronic sinus infections or ear infections, and we need to look at, do they have specific food sensitivities? I see it all the time. Very common for people to have a sensitivity to milk or gluten or corn or soy or chocolate or eggs. These are very common. If you keep on getting sinus infections, it's very often, yeah, you probably have a bacteria hanging out in there. I understand that. But the reason why it keeps on getting inflamed and irritated and unhappy is because you likely have an infection, and likely your gut's inflamed and having an issue too, and you're not able to clear it very well. So when you mess with your gut, you're going to mess with your whole immune system, and your immune system's not going to be able to eliminate the infection. Also, you're going to mess with your IgA. That's your immunoglobulins, your immune system, main part of the immune system that is hanging out in your sinuses, your throat, your esophagus, and your entire GI tract. So if you have these allergies and it's causing damage to your gut, it's going to mess with the IgA production, and it's going to make bugs produce more readily inside our sinus passageways, and it's going to be a huge issue. So number one is we definitely need to find the food sensitivities. We also need to focus on healing up the gut and find out whatever is causing the gut issues. If it is a food sensitivity, or if it is a chronic infection hanging out in there, or there's a chronic inflammation happening from some other source, like a medication or whatever that you're taking, we need to take care of that and start healing up the leaky gut or increase intestinal permeability. Because if we don't do that, the chronic infection is never going to go away. So we need to focus on that. You might have other chronic infections hanging out, not in your sinus passageways, but throughout your entire body. We need to definitely look at these because this could be a big culprit of what's going on too. We need to make sure that your hormones are working really well, because your immune system's not going to work well if that's having an issue, and many other potential causes there. But number one is we need to look at those food sensitivities if I just had to state one issue there. If you found this video helpful, make sure to click on the video to the right where we talk about more in depth about natural antibiotics.